Hello, today we're looking at Madonna. We're taking a deep dive into the evolution of Madonna's face, decade by decade, year by year, and we're going to explore what may have changed, why, and what it means for anyone who's interested in facial rejuvenation. Stay with me to the end, where I'll summarize the likely procedures, discuss the costs, and reflect on the lessons that we can learn from Madonna's facial transformation. So let's go back to 1982, age 24. This is the beginning. At age 24, Madonna's look is the epitome of natural beauty. Strong, defined jawline, full eyebrows, and striking, expressive eyes and character. Her hairline is low, her cheeks naturally have volume, her lips have a classic pillowy shape, the bottom lip is fuller than the top, which is the classic golden ratio, and a sharp and defined cupid's bow. Her jawline, her mandible underlying the bone is strong, it's clean, her neck is flawless, and this is the foundation of beauty, youth, and facial harmony. 1983, age 25, notice the youthfulness around her eyes, the upper eyelids are full, the infrabrow area is plump, there's no signs of hollowing, the transition from the lower eyelid to the cheek is smooth, there's no tear troughs, no shadows. These are hallmarks of youth, and they're features that many seek to restore with facial aging. 1984, age 26, well still there's no significant changes, her features remain harmonious and balanced, and this is really a testament to her natural beauty. 1985, age 27, she's still looking youthful, no obvious change of aging or intervention. 1986, age 28, well here we're starting to see the first hints of mid-face aging. There's a subtle increase in the nasolabial folds. This is likely due to the early descent of the cheek tissues. There's some mild volume loss, and this is a natural process driven by gravity and gradual loss of fat. And some women feel that they look better in their late 20s than their teens because they have more facial definition from loss of this volume and fat. 1987, age 29, well her eyebrows regain some of their fullness, but around the mid-face it's gentle, it's inward, and there's a slight downward shift. This is the direction that facial tissues move as we age with gravity, and it's why surgical rejuvenation often tends to reposition tissues by lifting upwards rather than pulling them tight. 1988, age 30, well there's no major changes in Madonna's appearance. The face remains balanced, it looks natural and youthful. 1989, age 31, still there's no significant alterations, her features look well preserved. 1990, age 32, well here it looks to be a turning point. Her hairline appears higher than compared to earlier years, and a possible sign of lifting of the brow. In the late 80s and 90s, a coronal brow lift was more common, and this involved a large incision in the hairline from one ear to the other ear, and this technique elevated the brow but also raised the hairline. And her eyebrows remain fixed in a higher position, and the overall forehead appears longer. 1991, age 33, her hairline still appears higher, reinforcing the likelihood of a possible surgical brow lift. 1992, age 34, well there's not much change at this point, her features remain stable and consistent. 1993, age 35, again, little difference from the previous years, her facial appearance seems consistent. 1994, age 36, well now we're seeing more fullness in the mid-face area. There's less bunching near her nose, and this could be the result of early volume restoration or subtle surgical intervention. And the sort of things that might give this is non-surgical treatments such as filler treatments or surgical treatments such as fat transfer or implants. 1995, age 37, well now if we look at Madonna's ear, in front of the left ear there's a small cartilage that appears in front of the ear, and there's also some stretch marks that lack the usual definition, which is generally the signs of a classic facelift and neck lift procedure. There's changes in anatomy along with the improved mid-face contour suggests her first facelift occurred around this time. Having a facelift procedure at one's late 30s can give better results for some women, as there's natural skin elasticity that can be rejuvenated. I found in my practice more and more younger women coming to see me who have facial aging. Now, often they have a genetic element such as hypermobility, but generally more and more people want to look youthful at a younger age. 1996, age 38, well, there's no dramatic changes. She looks like her appearance has been maintained. Post-facelift results are holding well. 1997, age 39, still the stability, there's no significant new signs of aging or intervention. 1998, age 40, Madonna's face is lengthening compared to her mid-20s. The once rounder, fuller face is now looking more oval. The philtrum area between her nose and her upper lip is looking longer, and this is a normal part of aging, as is descent and decline in the mid-face volume as part of descent of the cheek. 1999, age 41, well, now look at the left upper eyelid area. It's slightly drooping, and sometimes this can be suggestive of ptosis. This can be age-related or after surgery, and ptosis repair often means more than just removing skin. It means repositioning a tiny muscle that lifts the eyelid to open up the eye and improve symmetry. 2000, age 42, well, Madonna's face appears more volumized, possibly from fat transfer or non-surgical fillers. At this time, only collagen fillers were really approved by the FDA, and hyaluronic fillers were not around at this point in time. 2001, age 43, well, we see some upper eyelid hollowing, a classic sign of aging as fat and bone recede, and the lateral canthus, the corner part of the outer eye, and the lower eyelid can descend, making the eyes look less uplifted and more level. There could also be some early jowling at this time. 2003, age 45, non-surgical treatments such as Botox and fillers are likely to have been used. There's some maintenance of a volume, smoothing of lines, and these treatments are often used between surgical procedures. 2004, age 46, well, in Madonna there's no dramatic changes at this time. 2005, age 47, roughly 10 years after her first facelift, it appears that Madonna has had a second facelift. This aligns with the typical longevity of surgical results. 2006, age 48, well, Madonna's mid-face looks tighter, the jawline looks more defined, and possibly the signs of a recent facelift. She may also have had eyelid surgery, blepharoplasty, and possibly revision of her brow and lifting in this area. Age 49, no significant changes at this time. 2008, age 50, her brows look well positioned, her face maintains heart-shaped, V-shaped contour, and her cheek volume also looks preserved. 2009, age 51, the cupid bow of her upper lip is flattening. This often changes with natural aging. There's also some evidence of changes in bands in her neck starting to appear, which can be addressed either with non-surgical treatments such as Botox or surgical procedures such as platysmoplasty. 2010, age 52, a puffier look emerges, and it's likely she's had more volume, non-surgical treatments such as fillers injected in the cheeks and lips. Now, key is less when it comes to volumizing this area, as too much volume can give a pillow-faced appearance that looks unnatural. 2011, age 53, well, here her eyelids look more even, and it looks like the left eyelid that looked droopy or had ptosis in previous images, well, it looks like this has been corrected and both eyes look more open. 2013, age 55, well, continued use of Botox, neuromodulators, and non-surgical fillers have been used for maintenance. 2014, age 56, well, the signs of previous facelifts are visible. There's a line from the mouth to the corner of the cheek, sometimes called the Joker line. Now, this can occur in older techniques where the SMAS layer was lifted during facelift surgery, and if it wasn't fully released from underlying muscles during surgery, this could cause visible pulling in the corner of the lip. 2015, age 57, well, there's no significant changes in Madonna's appearance at this time. 2016, age 58, well, there's a suggestion of more volume, particularly in the mid-face, the lower part of the face. Now, it could be that this is done non-surgically with more fillers, or it could have been that Madonna had a surgical implant at this time. Age 59, age 60, her appearance remains stable. 2019, age 61, well, there's some evidence that there's some thinning of her hair, and this can be restored either with sealer or microblading. There's also some evidence that the mid-face and the lower part of the face has been heavily volumized. There's a slightly unnatural look where volume has been added most commonly during fillers or hyaluronic acid fillers that can be added in excess can create some of this appearance. 2020, age 62, well, the major change looks to be apparent. Possibly a third facelift, possibly a brow lift, other blepharoplasty. Her face looks still full from years of fillers, and it's hard to dissolve all the product before surgery. Now, often there's a combination of lifting of tissues, persistent fullness, and sometimes it's described as pillow-faced or alien due to the apparent widening of her face and narrowing of the lower face. Cheek hollowing may result from buccal fat removal. She looks youthful in some appearances, though can look unnatural as it just doesn't look quite how she looked as a younger woman. 2021, age 63, her face looks lifted, but there's some changes of signs in her neck area. The reminder that the neck often reveals your age, even when your face is rejuvenated. 2022, Madonna's age 64, was a year when Madonna's appearance once became a major topic of public conversation. At the Grammy Awards, her cheeks were fuller, she had a more defined jawline, her skin seemed smoother, and there was a lot of attention from fans and commentators on social media, with some suggesting she'd had non-surgical treatments such as fillers, others suggesting she'd had another facelift or implants. Certainly the upper third of her face appeared lifted, arching of her brows, forehead looked smoother and more even, perhaps with the use of neuromodulators such as Botox, and perhaps even a brow lift. The lips also were quite full, and the skin had this kind of porcelain finish, perhaps a combination of CO2 laser resurfacing or peels and meticulous skincare can give this kind of appearance. Certainly her face was more volumized, and the aging sides of her hands and neck were more apparent than ever, highlighting the importance of holistic rejuvenation. 2023, age 65, while Madonna continues to make stylistic choices in both fashion and facial aesthetics, her cheeks and jawline retain their sculpted, almost exaggerated contour, and suggesting the use of ongoing volume such as non-surgical fillers or surgical fat grafting. Her mid-face remains full, hollowing beneath the cheekbones hinted at the possible removal of buccal fat and shifting volume. Her eyes look more open, and there's minimal hooding, suggesting upper and lower blepharoplasty have been used. There was a lot of speculation about her appearance in the social media, and some feeling she looks unreal or doll-like. And Madonna herself addressed this in conversation, posting photographs saying, "Once again I'm caught in the glare of ageism and miscreant." Her statement was a reminder of pressure that many celebrities have in motivations between aesthetic choices. 2024, Madonna's age 66, and her facial contours have softened slightly. Perhaps some of the filler that previously there has been dissolved or reversed. Often she looks youthful but lifted, and there's a touch more natural movement to her cheeks and her mouth. Her skin has remained remarkably smooth, bearing in mind she's in her 60s, and possibly she's had advanced CO2 resurfacing treatments that can be combined with regenerative medicine and skincare to give a smoother appearance. Her jawline remains consistent, and she probably had lower and face and neck lift surgery at some time to rejuvenate this area. Now, she shared various selfies that suggest that there is some natural aging alongside kind of decades of aesthetic care, non-surgical and surgical. 2025, age 67, well, Madonna still stands out as an icon of rejuvenation, both musically and visually. Her face now reflects a blend of surgical artistry, non-surgical maintenance, and a natural evolution of age. Her cheeks and jawline remain prominent, but there's overall more balanced effect than in previous years. Perhaps more strategic reduction in volume and filler, and more focus on skin quality over volume. Her brow remains high and the eyelids more open and bright, and maintaining a kind of signature appearance. Fine lines softening around the mouth and chin are visible, adding some character and depth to her expression. In interviews, Madonna openly talks about her journey, saying, "I've always believed in pushing the boundaries on stage and in life," and her face tells her story. Now, in my opinion, Madonna has likely gone at least 3 facelift and neck lift procedures, 3 brow lifts, and multiple upper and lower blepharoplasties. She's likely to have buccal fat reshaping and many non-surgical treatments, including the use of fillers and neuromodulators, plus in addition volume with fat transfer and possibly implants. In terms of costs, well, facelifts and neck lift surgeries can range from $50,000 to $150,000 each, and brow lifts $5,000 to $30,000. Upper lower blepharoplasty similarly from $10,000 to $30,000. Other procedures and non-surgical treatments are likely to have been in the order of $10,000 to $20,000. It's likely that she spent hundreds of thousands of dollars on these treatments and may well have reached more than $500,000 in terms of costs over the decades that she's had this maintenance and treatments. Now, for Madonna, maintaining her appearance is part of her career, her public persona, and while at certain times her choices may have seemed excessive, it's very much a pathway that many celebrities have followed. Facial rejuvenation is definitely a journey, and it's not a one-time event. It's about balancing surgical and non-surgical options, and respecting natural anatomy is key to making sure that facial characteristics are preserved over this time. I do hope this information has been helpful and enjoyable, and if you have any thoughts or questions, please do not hesitate to comment or contact us. Thank you for watching.